Labour is committed to stopping the suicide crisis in England and Wales. We know that suicide is preventable and that every life lost is a tragedy. That's why we have a plan to reverse the trend and reduce suicide rates within 5 years. Our plan is to modernize the NHS and make mental health a priority. We will invest in more staff, more beds and more services for people who need help. We will ensure that everyone can access high-quality, evidence-based care when they need it, without long waits or barriers. We will also tackle the biggest killers, including suicide, by addressing the root causes of distress and despair. We will end austerity and poverty, create good jobs and fair wages, support families and communities, and protect the environment. We will build a society that values and respects everyone, regardless of their background, identity, or circumstances. We believe that everyone deserves to live with dignity and hope. We believe that suicide is not inevitable and that we can save lives. We believe that together, we can create a better future for all. That's why we urge you to vote for Labour in the next election. Suicide is a tragedy that affects thousands of families every year in England and Wales. It is also a preventable cause of death that can be reduced by improving the mental health and well-being of our population. Labour believes that the NHS needs to undergo 3 big shifts to achieve this goal. From analog to digital, from hospital to community, and from sickness to prevention. The first shift is from analog to digital. This means using technology to enhance the delivery and quality of mental health care. For example, Labour will invest in online platforms that offer self-help tools, peer support, and counseling for people who are struggling with their mental health. Labour will also expand the use of telehealth and video consultations to make it easier for people to access professional help when they need it, especially in rural areas or during the pandemic. The second shift is from hospital to community. This means shifting the focus of mental health care from acute settings to community-based services. For example, Labour will increase the funding and staffing of crisis teams, which provide urgent support for people who are at risk of suicide or self-harm. Labour will also ensure that every person who is discharged from a mental health hospital has a follow-up plan and a named care coordinator who can help them with their recovery. The third shift is from sickness to prevention. This means addressing the root causes of poor mental health and promoting positive well-being. For example, Labour will tackle the social determinants of mental health, such as poverty, unemployment, homelessness, and domestic violence, which can increase the risk of suicide and self-harm. Labour will also invest in prevention programs that target high-risk groups, such as young people, veterans, and LGBTQ+ people, and provide them with tailored support and education. Labour believes that these 3 shifts will transform the NHS into a world-class mental health service that can prevent suicide and self-harm by improving access, intervention, and support for people who need it. Labour's vision is a society where everyone can live with dignity, hope, and happiness.